Let me put the first question to the speakers. What can the Institute for Science and Human Value do to propagate your message?
Is this on? Okay. Well, I would like to see something in the literature and on the website concerning alternatives that we all discussed. I didn't get a chance to tell you about our Secular Day of the Dead celebration, very much like the Dead Cafe. And if you'd like information about that, please see me for some literature. And I think the organization can find ideas and promote them through the website and literature.
Refer chaplains to the American Ethical Union to be trained and certified as humanist healthcare chaplains. Let them know about us.
Good. Yep.
I think what the Institute could do would be to, two things. One would be to offer perhaps four to six guidelines that individual members could take back to their community groups, and work on motivating healthcare facilities to provide equally for their secular patients. And probably more importantly, see if you could form some type of a coalition with the national organizations so that we can speak as one voice. The key is, again, we want to cut down on the infighting and expand the efforts around small projects. And I'm hoping this is a project that the national organizations could coalesce around. Thank you.
Possibly to identify and collaborate with progressive religious organizations, chaplaincy organizations.
Thank you very much. Dr. Lewis, what is that marshmallow test you said?
Oh, yeah, I was going to ask you about that.
So for those who don't watch YouTube videos, no, okay, preschoolers in the 60s or 70s, probably 60s, were given a test of sitting in a room with one marshmallow on a plate in front of them, and instructed by the psychologist experimenters that if they could refrain from eating that one marshmallow for 15 minutes while the experimenter went out of the room, they could have two marshmallows when the experimenter came back, and they were videoed. And there's a whole spectrum of different kinds of kids, those who eat it impulsively and those who sit on their hands and, distract themselves and hum tunes and all sorts of things, or those who look at the marshmallow intently and and those who reach for it and then inhibit the action and so on. Much more interestingly, they were followed up years later. They're still being followed up, these people, and this trait of self-control as a preschooler is highly correlated with all kinds of measures as adults of success and self-control. And all kinds of interesting brain measures.
Anne or Margaret or both of you, we see this all the time. The humanist leader dies, but the family is very intent on doing a religious service. As friends, what can we do?
Perhaps you could suggest a whole different ceremony. Maybe that's the answer, is to go ahead and have the religious people do their ceremonies, and then you offer up the secular ceremony. And that way no one is hurt. They're just, I hate to say that, separate but equal. but basically you just don't, the dead person's not going to know, but it gives hope and comfort and solace if the religious people can have some kind of ceremony.
I think we also need to get away from the magical thinking of funerals and memorial services. They are indeed for those who survive. One of my members came to me and for pastoral counseling, and was telling me a story about how dysfunctional his family was and how rancorous his relationship had been between himself and his sister. Well, their mother died. The sister held a religious memorial and never even told him. So he would have gone. So anyway, I listened to him and I said, you know, we could still have a memorial service for your mother. We could do it right now. We could do it later with your family. And he never took me up on it. But that was okay, because he knew that he could. And I think it's important for us to empower people and let them know that they can do what they need to do, and that there are people available. You know, my memorial service is in that Humanist collection there. You can also find it online. So there are resources for you as a family and friends online. You know, friends can meet at the local pub, and they can have a memorial service.
The religious groups, are especially Catholics, buying the hospitals right and left. When we are all working for those hospitals, what can we do to assert our rights? We are working for a religious group, you know. How can you do what you want? The board of directors are not going to listen to us, Joe.
Would you like me to respond?
Yeah, please.
Okay. Well, you know, I think we can simply start off by being honest. I think there's an exaggerated reluctance among many of us, including physicians and nurses, to come out of the closet as to who we are. I've heard there's reluctance to let people know that we're humanist, essentially that we're non-theist. I'd like to encourage us to, number one, let people know in a courteous manner that we're non-theistic, we're humanists, we have values, and then encourage the hospital for its sake. I would try to focus on the hospitals, helping the hospital to meet its professional responsibilities, and help them to be groundbreakers in this area, help them understand that more and more of their patients are secular, and we like to see that hospital be in the forefront of providing secular support.
We also have a lot of new statistics that we can take to administrations of facilities. The nons are just growing in leaps and bounds. So we can present these graphs and talk about the needs of the community changing. And we're here to promote the fact that secularists are growing and growing, and our needs are not being met.
So, you know, in Canada, the situation's different because of the public health system. Hospitals that were once religious a few decades ago and still carry religious names are all secular public institutions. They may still have a cultural emphasis on a certain religion, but it certainly doesn't affect patient care or policy in any way, at least in the major hospitals. The shoe is on the other foot in Canada because chaplaincy services are trying to prove their relevance. Hospital boards are wondering why they should be spending money employing chaplains as opposed to just having volunteer ministers come in from the community to perform the service, which administrators think this is just about rites and rituals and things like that. But they're not. The administrators need to be persuaded by the chaplains that actually the chaplains do some very serious counseling and therapy. And so they're very eager to demonstrate their relevance in an increasingly secular society. But by the way, they also want to become registered as psychotherapists, which was a nebulous term in Ontario. Anyone could hang up a plaque and call themselves a psychotherapist, no longer.
Tony is going to address later on the programs and progress of the Institute. But now there are questions. Are there organizations that provide secular support, referrals? And also, what can we do to the young children, especially, like a Sunday non-believers program or something that will attract them? Instead of Sunday schools, they can go into Sunday secular on the net. Who wants to take it?
Well, this is not an answer, but it's a frustration. As an organization, Humanists of the Treasure Coast, we've asked ourselves, what can we do to bring in more families? We aren't having much success. We have some parents who've contacted us. They will very seldom come to a meeting. we have a connection with them, but we're not having good luck in bringing them into meetings, and I'd love to hear if anyone else has got the answer to that. Thank you.
I'm going to push the secular Day of the Dead event. And I hope someone will pick this up in the secular community. It's a family thing. It's a way of honoring someone's life. It's called the Day of the Dead, but we're honoring living. And when we talk about our dead loved ones, we're getting some closure in that. But, you know, you can make a ceremony out of this by having food and a piñata and music and speeches. And, you know, if you make it more of a family venue, then you're going to attract those families. But, you know, having a celebration of life, I think, is so important for us secularists.
Plus, thanks.
I can tell you what we are doing with the Periyar movement in Tamil Nadu. We are having competition for kids, school kids and high school kids, in speech, in music, to bring out the secular ideas and have answer and questions, and whoever answers the right, they get prizes. So the competition, music, these are the things that we should be looking forward to carry on with the young people, our ideas. This is in Tamil Nadu, India. So.
At any ethical society, or most, I hope, you will find ethics for children, programming for children. So we're intergenerational. We say we're there from womb to tomb. And we have families involved with us. But I understand that there, especially I'd say in Protestant, well, not only Protestant, but in some traditional faiths, different denominations have become more liberal and more progressive. So I think that even if a family does not believe, even if parents are not raising their children that way, they may hold their noses and go into a church, a synagogue, or whatever, because for the sake of tradition. If you are not near an ethical society, please look for Dale McGowan. Dale McGowan wrote a book, Parenting Beyond Belief. He has the Beyond Belief Foundation, and I'm very happy to say that he is the Ethical Education Director at the American Ethical Union.
I thank Tony and the friends for putting together this excellent program, and I thank the speakers for taking the time coming over here and sharing with us all your thoughts. It's really nice. Very appreciative of all the efforts going on in this room. Let us march forward. Thank you all.